Breaking news. There have been multiple cases of sickle cell anemia in the United States. Fortunately, those cases are being treated by trained doctors. We took a look at what this disease is, what its dangers are, and how it's transmitted. So we sent out our very own reporter, Dontarius Brown, to get information from an experienced doctor at Johns Hopkins Private Research Facility. Let's take a look.
Welcome back to 69 Seconds. I'm Dontarius Brown.
And I'm Dr. Gilverius Thomas Ingram from Joseph III. I'm here to talk to you about sickle cell anemia.
So what does sickle cell anemia do exactly?
Well, sickle cell anemia is a genetic disease that is found in the hemoglobin of the cell and is passed down by your parents.
Wow, you can only get it from your parents?
Yes,
Nowhere else?
Yes, unfortunately 2 million people carry the trait of sickle cell anemia and 100,000 people have the disease.
Can you actually die from sickle cell anemia?
Yes, you can die from sickle cell anemia because most of them who have this disease suffer from organ failure. Also, these patients who have the disease can potentially die from acute chest pain episodes or strokes.
What does sickle cell anemia affect in your body?
Well, sickle cell anemia affects the hemoglobin in the red blood cell, causing it to have a sickle shape. When these cells get stuck in the bloodstream, they block blood cells from passing through the body and making it difficult for oxygen and blood to get to the rest of the body. Also, these cells have a shorter lifespan than regular cells, causing less cells to be present in the body.
Is there any way to cure sickle cell anemia?
No, but there are treatments that can help you with the sickle cell anemia, which is bone marrow transplants, blood transfusions, and scientists are developing a genetic editing tool called CRISPR that can edit these base pairs that cause sickle cell anemia.
How do blood transfusions and bone marrow transplants help treat sickle cell anemia?
So what blood transfusions do is it helps in assisting the blood's oxygen carrying capacity, and then can flush out the cells that carry this disease. Bone marrow transplants also help the disease by replacing the unhealthy blood forming cells with the new healthy ones. Bone marrow transplants can come from family members of the patients as well.
Thank you, doctor.
My pleasure, and thank you for having me, Dontarius.
Sickle cell anemia is a genetic disease that affects hemoglobin, the oxygen transport molecule in the blood. The disease gets its name from the shape of the red blood cells under low oxygen conditions. Some red blood cells become sickle-shaped, and these elongated cells get stuck in small blood vessels, so that parts of the body don't get the oxygen they need. Sickle cell anemia is caused by a single letter change in the DNA. This in turn alters one of the amino acids in the hemoglobin protein. Valine sits in a position where glutamic acid should be. The valine makes the hemoglobin molecules stick together when the oxygen tension is low, forming long fibers that distort the shape of the red blood cells. And this brings on an attack.
We will now be interviewing a journalist that had a one-on-one conversation with a patient who has sickle cell anemia. Good afternoon, Ms. Rose.
Good afternoon, Dontarius.
What was the name of the patient you interviewed?
His name was Timmy.
And how was your experience with Timmy?
Well, Timmy was a great person to interview. He was just like any other child, happy and respectful. But he did tell me that it was difficult enjoying himself sometimes. He was limited to activities that he could do outside with his friends. He was quick to get out of breath and would have chest pains doing regular tasks. He said it was difficult using the restrooms, and he would always get dizzy, fatigued with low intensity activities.
Wow, that's interesting. Is there anything else Timmy struggles with?
Well, he has swollen feet and hands, and has small areas of yellow on his skin and eyes. He seemed to be more pale than other children.
That was very interesting, Mr. Rose. Thank you for your time.
No problem, and thank you for having me. In review, we looked into what causes sickle cell, its effects, and how patients with sickle cell live. Thank you for joining us in a special edition of 69 Seconds. By trained doctors. We took a better. God damn it.
What are you? Welcome back to 69
Shut up,
Seconds.
Nico.
Do you want this one?
No, I want this one.
Okay.
I want this one.
You sure? Oh my butt. Let's go.
Wait, so what?
You filming this? You better not. You probably are. He's limited to activities that He was limited to outside activities.